Well, anxiety is something many people deal with, and it's important to understand that everyday anxiety can be a normal response to stressful situations at the time. Well, joining us today to talk more about that is Dr. Allison Chase, psychologist at AK Chase Consulting. Thanks for being with us.
Sure, thank you for having me.
So many people have anxiety. You know, what's the first sign that we need to look to?
Yeah, well, it's how it's getting in the way or impairing your life, whether it be school or work or your relationships or interactions. That's what's really important. It's also important to know that the basis of anxiety, that physiological feeling that one feels, that part isn't overly concerning in itself, because that happens in a lot of situations. It's almost like the worry that we attach to it that
right.
then turns it into what can be reoccurring and a problem.
So every day, say anxiety, what do we need to understand about that before we take the next step? So, oh, I need to get help, or I don't need help. You know, every day we do that all the time, everyday anxiety.
Right. My hope would be that somebody would not say, I don't want to get help. Like, that is what's so important, right?
Yeah.
Anytime there's anything like anxiety or other emotional issues that are affecting your life in some way, like, makes school really difficult to do, you're not showing up at work, or how you're showing up is hard, or within relationships, maybe you're withdrawing more or having a lot of conflict, those would just be examples. Anytime that is happening, we want to consider getting help, because it means that we have some things to talk about and to deal with.
Right. So that's what I guess you kind of answered my question.
Sure.
So when it starts to get a little more serious than just, God, I wish this day was over.
Right.
Or so when do you know it's like, okay, I need to see a doctor, maybe get some meds?
Yes. I mean, all of that for sure. I'm always a fan of, why don't you go find out and see. Now, as it's getting started, it is okay to use some strategies, our own, let's call them self-care, self-help strategies, right? To do that at first, to see if that can help manage it just a bit. Things like working on your breathing and slowing down your body and slowing things down physiologically to see if you get some relief, right? Doing things that give you peace and you enjoy. It could simply be taking a walk outside, being part of nature, doing something like that, right? It sometimes means taking a look at, all right, what is creating this? What is happening? Like, identifying it is something that can be really helpful, and to see if we have some strategies to solve that on our own.
Yeah, and it's also, I was going to say, it's okay to have anxiety. There's nothing wrong with this, if it does get a little more out of hand anyway, correct?
Yeah, yes. And you're right about the fact that, of course, anxiety, especially in this day and age, has become kind of a normal part of our daily activity. It seems, for so many. And so it's not that in itself is so abnormal. It's what impact it's having on your life.
Right.
That is really where I would want somebody to be very mindful and to go seek help. Go inquire about whether or not you need more help.
Yeah, I was going to say too, those things we can do at home, breathing. And I'm still, what if I'm doing that? I still got all the stuff to deal with. The breathing's not helping. Then what?
Well, if the breathing's not helping and it's not working, you consider reaching out to get some psychological help. And there are so many incredible resources that we have today to be able to at various, low-cost options within our community, to be able to reach out to, as well as finding, your own sort of personal therapist or group.
Like the breathing, you can do that. You would just kind of take a breath, let it out, and how often do we?
Yes, so I'm a big fan of the box breathing, which is actually like a 4-count breathing in,
holding it,
over. No, not so much holding it, like taking a breath. Yes, to hold it, over, to let it go really slowly.
Slowly, okay.
And then to breathe in again.
And then go
and
again.
Then take it out really slowly.
So not this.
Okay, that will not be helpful. So the idea to doing what they call this box breathing, right? You take it in and hold and begin to let it go, is actually quieting your entire physiology, and it has this really powerful effect in settling down your brain. The base of your brain is what holds all those emotions, and it can be really powerful. When our brain, or that basic part of our brainstem area that controls all of this physiology, when it settles down, we get to use like kind of that front of our brain, the frontal lobe area, to make better choices, to recognize what's going on, and to be able to think about it.
All right,
So,
perfect. Thank
yeah.
you so much for that advice.
Thank you.
Thank you.